A COVID subvariant that's on the rise around the world appears to be more infectious, but health experts say there's no indication the strain, called EG.5, causes more serious illness than previous strains. To talk about this new subvariant, we are now joined by Dr. Isaac Bogosh. He's an infectious diseases specialist with Toronto General Hospital. Dr. Bogosh, good to see you. What separates EG.5, this EG.5 subvariant, from the other strains we've already seen?
Yeah, this is, as you point out, this is another sublineage. It's still under the Omicron umbrella. And prior to this emerging, we were really seeing XBB sublineages predominate. It's sort of an alphabet soup of sublineages. And really, this is just a few mutations away from what XBB is. So yes, it's distinct. Yes, it's clearly a bit more transmissible, and we're seeing certain parts of the world have uptick in cases and, of course, associated hospitalizations. But it's not vastly different from XBB that we saw earlier.
So still in the Omicron family, you mentioned we're seeing upticks around the world. What is wastewater data telling us here?
In Canada, we're seeing pretty heterogeneous activity. So some areas are showing a clear uptick in wastewater. Other areas, the wastewater is flat. But we know, I mean, we don't need a crystal ball to know what's going to happen. We already know that we are expected to see a rise in the wastewater surveillance, which of course corresponds to a rise in community cases of COVID-19. And of course, that's associated with, sadly, a rise in hospitalizations and deaths. So we know we're going to see that as we move through the summer and into the fall. I think the key thing to remember here is, of course, we need to take COVID seriously. Of course, we have to take steps to protect ourselves and our community. But I just don't think we're going to see anything remotely close to what we saw in the first few waves of the pandemic, where we had, for example, our healthcare system completely overwhelmed. Like, we're just not going to see those scenes. And the reason we're not going to see those scenes is because so many of us have been vaccinated. And in addition, I can't stress this enough. We don't want anyone to be infected. We just can't ignore that a ton of Canadians have been infected and recovered from infection. And that combination of vaccination plus recovery from infection has really provided us with pretty significant community level protection against more severe manifestations of the virus. Of course, there's people among us we obviously need to protect and care for that are at greater risk, but we won't see the scenes that we saw much earlier in the pandemic.
Mm-hmm. The WHO, Isaac said, there is still a risk of a more dangerous variant emerging that could cause a sudden increase in cases and death. At this point, do you think people are aware enough of that risk that we could see something brand new at some point?
Yeah, I mean, that's a great point, right? Of course, we know COVID can of course mutate, and there's always the possibility of a more virulent or more severe strain emerging. And of course, apart from COVID, there's always the risk of disease X emerging and another pandemic with an unrelated organism. So we always have to at least acknowledge that and prepare for that. And I think that's why it's so important that Canada takes significant steps for increasing our ability to have early detection systems and also prevent and respond quickly to any emerging infectious disease threats. And, we don't have to step back too long to see several of these land in Canada. We had SARS-1, we had H1N1, we've had Mpox, we've had this, with COVID-19. Like this, we know this is going to happen again. The real question is, what is the pathogen going to be, and when is it going to happen? So we, of course, have to be prepared.
Mm-hmm. When you run through that list, it really does take us down a path of the last 3 years. Let's talk immunity. NACI recently recommended getting a booster shot for the fall when the likelihood of respiratory illness increases with this new variant spreading. Do you think this booster would be formulated to provide better protection against this new variant?
I do. I don't think this particular sublineage of Omicron that's emerging in Canada and elsewhere around the world, this EG.5, is vastly different from other recent Omicron sublineages. So, I think what we're going to see with the vaccinations is that it will continue to provide very meaningful protection against more severe manifestations of the virus, like hospitalization and death. And I think those benefits will be most strongly realized in people who are at greatest risk for severe infection. For example, the elderly, or those with underlying medical conditions, like those who have immunocompromised states. I think that's what we're going to see. What we don't see as much anymore is that the vaccine just doesn't provide us with the same degree of protection against infection as it did earlier in the pandemic. There's still some protection, but it's not nearly as strong, and it doesn't last for as long. But I do think this vaccine will be helpful, and especially helpful for those at greatest risk for severe infection.
So the benefits are still there, but given the pandemic fatigue we've seen, there's still a fair amount of misinformation that's circulating. Do you think it'll be hard to convince Canadians to get that booster and get vaccinated?
Yeah, it absolutely will be. I think it's going to be an uphill battle, and I think if we were smart about this, we'd start now, and we'd start discussing what the vaccine is, what it does, who would be eligible for it, how to get it. We should really be having those conversations now. I think we also have to have honest conversations about what the vaccine does as well, right? I think we should be telling people what the real purpose is for, and who is going to most strongly benefit from this vaccine. Otherwise, I think without a clear communication plan and a clear outreach plan to lower all possible barriers, I don't think we'll see the uptake that we would desire. And again, I can't stress this enough. It's especially important for those at greatest risk of severe infection. We know who lands in hospital with COVID-19. We know who sadly succumbs to this illness, and we should really be taking extra steps to tailor our efforts to target those at greatest risk.
I just have a little bit of time left, Dr. Bogosh. I just want to squeeze in, kids are headed back to school soon. What should parents be doing to protect their children and themselves against this new subvariant and other respiratory viruses, which we saw really peak last year as well?
Right. Yeah, great point. So obviously it's not just COVID-19. We know it's going to be flu season and RSV season. And, it's of course important to stay up to date on vaccinations and really watch out for that fall influenza vaccine campaign. But I think other steps that we can take too include improving the air quality in indoor settings. Of course, that includes schools. And again, it's not, of course, it's helpful to at least reduce the risk of the spread of infectious diseases, but there's a myriad of other health benefits for improving the quality of indoor air. And I think that's one additional area of focus that we could really lean into, especially now. I mean, obviously, it's never too late to start that process. It could have been helpful years ago. I know there were some efforts on that front, but we should really be leaning into this as we move forward.
Dr. Bogosh, we always appreciate your input. Thank you so much.
My pleasure.